Okay, so hi, I'm Kim. I'm a nurse, and I've been a nurse for over 20 years. You guys, that makes me feel really old. I know you guys can all relate to that, right? So today we're going to talk about pain. So who here has either had chronic pain or knows somebody whose life has been made smaller by pain? Most of us, right? It's a pretty huge burden on not only our own lives, but the lives of the people that we love and the healthcare system. And that's exactly what I've experienced over the 20 plus years that I have been a nurse. So today we are going to talk about, okay, what is pain? We don't even understand it. We're starting to learn. So we're going to look at the types of pain. We're going to look at how can perception, okay, just the perception of having pain, how does that affect us? How does that affect our brain and our body? Our moods, totally. Who here believes in the brain-body connection? Yes, yes, yes. I'm so glad you all raised your hands, because I know Hannah would expect you all to raise your hands, right? She talks about this, doesn't she? So, chronic pain and acute pain. What are the differences? These are going to be some of the things that we talk about today. I, as a nurse last year, working in the emergency department for over 20 years, I got burned out. That happens with emergency medicine, doesn't it? We see a lot. So I decided to take a deep dive into pain. I think some of you heard my story last time about my neck injury. So I suffered myself with chronic pain. And I wanted to take a deep dive into why do we continue having pain after our bodies have healed? Right? Our bodies have an amazing ability to heal itself. Who here knows, how long does it take for you to repair a bone? How long does it take your body to repair a bone? Okay, I heard a year. Yes, yes. 6 to 8 weeks, 8 to 10, depending on how old you are, right? So our bodies have an amazing ability to heal. Why do we still have pain after our bodies have healed? That's what we're going to talk about today. So we know there's a huge burden of chronic pain. I just had to update this slide from 60 to 70. It's growing. And I don't know if you know this, but women suffer with chronic pain more than men. It's a little bit higher for women. Interesting, right? Women. What is that? Why? Why is that? Costs a lot of money. That's not the important thing for me. The important thing for me is quality of life. How can we improve our quality of life? And are there some other things that we can do than just the typical stuff, right? Physical therapy, medications, physical therapy, all of those things are great because they're tools, right? They're tools to help us move easier. They're tools to help us to feel better. So it's a system problem. I'm not going to go over that very much. But even if we have an injury that needs surgery, which we do. My husband injured his rotator cuff a couple weeks ago. Well, it's been about 2 months ago now. And he had to have surgery. It was torn, right? So sometimes we just have to. We have to do traditional Western medicine and then look at some alternatives after that as well, right? So even though we have surgery and we have physical therapy and we have our body's attempt at healing itself, we can still have pain. So I kind of went over this last time. I'm not going to go about it into too much detail, but as an emergency nurse, I've seen a lot of things. Did you see something?
That spine
It is in bad shape, right? Can you see that? So this is a side view of a picture of a spine. You see vertebra here, here, here. Whoa. Whoa. What happened?
I've had 3 major surgeries
Yep.
right on there.
Okay, so you know.
Yeah.
You've probably seen pictures of your own spine.
Yeah.
I hope it didn't look like that.
Not quite.
This was a severe car accident. So life-saving procedures, I flew on Life Flight for a little while. Amazing career, I loved it so much. I even have the opportunity to go back to New York City, Manhattan during the COVID crisis with the team from Intermountain. And that was kind of like a pinnacle highlight of my career. It was a really cool experience. It was scary, definitely scary. So my question for you is, become a little curious about what I'm talking about today, okay? Curiosity is so important, especially as we age. I'm aging. We're all aging, right? We can't get away from it. So curiosity, that's what I'll ask of you today, is just be open and curious. Okay, so I founded, after I had a pretty significant burnout episode last year, I founded Nervana. So Nervana, because I help with nerves and nervous system. So I have sort of a couple of tools as well. I have a little toolbox. And we'll kind of go over these briefly, but I do the targeted electrical nerve stimulation. This is high pulse electrical stimulation. This is my device. Jim tried it out last time. What did you think, Jim?
Since then, I've got a torn rotor cuff,
So we've got some work to do.
It was interesting.
We've got some work to do, right? Yep, you and whoever you decide to help you with your rotator cuff has some work to do, and that's okay. I also do a little bit of IV nutrition and hydration. Who doesn't drink enough water? I don't drink enough water. My patients love the IV. It has 3 different nutrients in it, and it just helps with recovery and restoring, and it's really targeted for nerves specifically. And then I do something, because I spend a lot of time with my patients, which I love. I love the older adult population. It's my favorite. I do what's called pain reprocessing therapy, and it's kind of talking about what I'm teaching you today a little bit, is understanding what pain is, why do we still have pain after our bodies have healed, and what kind of things, what tools do we have to be able to get over that fear. Sometimes it's a fear, right? It's a fear of pain. It can be fear, frustration, pissed off, whatever you want to call it, right? Pain causes those emotions to come up with us. I know firsthand. So these are my goals. Let's see, tell me your name.
Daryl?
Daryl, thank you. How many times have you been asked, Daryl, what's your pain on a scale of 0 to 10?
Oh, probably 100.
100 at least, right?
Yeah.
As an emergency nurse, I've asked it thousands of times. It's a tool, right? It's a tool that we have as providers and even as individuals for us to kind of see, okay, where are we at today? If we're going to take physical therapy, if we're going to do some physical therapy, what's our pain before, what's our pain after? Those are tools that we have. However, for me, it's not just about a number. It's about quality of life. It's about function. It's about how do we get you doing the things that you want to do with the body you have today, right? May not be when you were 20, may not be even when you were 40, but what are the things that we can do and adapt to having a better quality of life? That's what I love to do. Okay, so this is a review. There's a lot of science that we've been able to research over the last just 5 to 8 years about the brain and the body and how they work together to either heal pain or sometimes make it a little bit worse. So this kind of goes back to the perception of pain, okay? If you have, let's say, low back pain, I have had that as well in my life, and you are just like, I got to figure this out. I got to go to the doctor, see what they can do, right? Maybe you got an MRI, and the MRI showed disc degeneration, okay? Does anybody know what that means? Degeneration. It's wearing out. What else did I hear? Falling apart. Exactly. Yep. Okay. I mean, our bodies are pretty amazing, but we also are living a lot longer than we used to. Okay, which is awesome. Like, that's why all of you guys are here, because you want to live the longest life possible with the best quality of life, right? So there's a study that was done, lots of different studies, but we're going to talk about backs today. So they took 3,000 people with no pain, okay? Asymptomatic patients, meaning no symptoms. And they imaged their low back. They got an MRI of their low back, and this is what they found, okay? These are pain-free patients. So disc degeneration in patients in their 30s, 52%, over half of those patients had disc degeneration, which is considered an abnormality, but is it? Pain-free, a patient in their 30s, probably not. It might just be normal wear and tear, right? On the body. When you look at people in their 80s, this does not apply to any of you in this room, okay? Nobody here. So when you look at people in their 80s, 96% of people in their 80s have abnormalities on their scans. So what does that tell us? It's a normal abnormality. It can be, right? It can be a normal abnormality. Of course, your back surgeon and all of your doctors, you want to go by kind of their advice. But also with the technology that we have with imaging these days, we're able to pick up on a lot of stuff that we didn't used to be able to. And we're not really sure what to do with this information yet. But there is a reason why there is a syndrome that's called failed back surgery syndrome. Who's heard of that? It's an actual medical diagnosis. That was a good catch. Because they fail a lot. Mm-hmm. Yep. Okay, curious? Am I piquing your curiosity? I hope so. And at knees, just knees alone, and this doesn't have an age, but look, 97% of knees show abnormalities. Okay? All right. Okay, really quick review. So,
No pain. They don't have
no pain. No pain. These are all pain-free patients. Yes?
I was having problem with nerve pain down my legs.
Uh-huh.
They thought it was because of a cystocele that I had.
Okay.
And then I was sent to the neurologist to make sure that my automatic nervous system was working
Okay.
before they would repair the cystocele.
Good.
And he ended up doing an MRI of my back. And he said, your nerve pain's coming from your back. Your back is badly degenerated.
Okay.
I said, but I don't have back pain. I was in my 80s at that time.
Interesting.
I
Interesting.
do now, but
You might now, but at the time, you know, like they're giving you things that you're not even looking for. Tell me your name.
Judy,
Judy, I met you last time.
it's neuropathy now.
It's neuropathy, and you know what? Neuropathy is a real thing. Neuropathy is a tough one. I treat a lot of neuropathy. So thank you for sharing, Judy. That's pretty huge. Judy said that they were looking for something, and they ended up imaging her back. Even though she didn't have back pain, they said, well, it's coming from your back. It's a nerve problem. And she's like, well, I don't have any back issues. She does now, but so thank you. Thank you for sharing. All right, so just a quick review from last time, the difference between acute and chronic pain. My husband, when he injured his shoulder, that was an acute injury. The stimulus from that tear in his shoulder is a signal that was sent to his brain really quickly through our nerves. And our brain, because it's a danger signal, does what? So if you put your hand close to a flame, that's a stimulus that your hand is receiving. That information is communicated up to your brain really quickly, and then your brain says what to your hand? Move it away, right? That's a normal functioning pain signal. Pain is our friend, okay? Pain is our friend in an acute injury. Chronic pain, this is something that typically lasts over 3 months or our body's normal ability to heal itself. So when I injured my neck, my neurosurgeon said, Kim, it's going to take about a year. It's going to take about a year to heal that. There's tools that you can use. There's physical therapy. There's medications. There's pain clinic. There's injections. Lots of things you can do, right? I still had pain after a year. I still had pain. The chronic pain continues despite all of these things that we can do. And even abnormal findings on scan may be normal based on a normal aging process, okay? Okay, so with a chronic pain situation, there's a couple of things that could be going on, right? Nerves are misfiring, okay? Our brain is interpreting that signal from my neck as danger still, for whatever reason. And so guess what? I moved a little differently. Every time I tweaked it a little bit, I'd be like, I don't want this to hurt again. I don't want to have a bad day. I would wake up in the morning and I would be like, it's gonna be a rough day today. I moved differently. I was scared, okay? And our brains are pretty powerful, right? My brain was thinking danger, danger, danger still. And so my brain was sending actual pain signals to my neck. It's real, totally real. I will never, ever, ever tell a patient that your pain is all in your head. Has anyone heard that before? Probably. My patients say that a lot. because they just can't find a reason why. Your brain, your pain is real. All pain is processed in the brain, however. Okay? So there's the difference. It's not something that you're making up. It's a danger signal that your brain is still sensing from your body. And your brain is generating that actual signal of pain. So we call this neuroplastic pain. This is a pain that continues despite all of the different tools that we have, and it's actually really